a cascade of labs that can be positive on a person, and then as they get older and older, new labs will come up, and stream quality has been automatically lowered because, oh, sorry. So I'm working with this live stream software, and it's still a little bit rough, so you just have to excuse me as I go through this, but I'm trying to make this work out as best I can. So the point is, as people get sicker over decades, different labs will show up in almost like a chronological order. And so I'm going to talk about that. And then I'm going to talk about this modern study that I found on lactic acidosis. It was just released this year. Actually, it's February of this year. I'm going to highlight some of the good points of this article from PubMed. So, and before I even start with any of that, I want to talk about people ask me when I'm writing my book. And I actually started writing a book about 4 years ago, maybe more. And I had a helper from Florida, and I was learning all these, not 4 years ago, it was probably 2 years ago. But as I was writing with her help, I kept learning more cool stuff that needed to be in the book. So my research wasn't completed. And so I stopped writing it. I got 80 pages in. And I'm not going to go actually with that sort of format. I am writing now. I have somebody helping me, another person. And the information will be, is typed out. I'm almost done. And it'll be electronic, meaning we'll have, buffering is bad. Oh boy. Uh, so hopefully this streaming will be just fine, but sorry about the buffering. So give me some comments here and there about the buffering. Just let me know. See if it improves or not. So I'm doing the best I can with this. So anyways, the information is being typed out. We're almost totally done. Right now we're at 40 pages, and it's very concise. And he's helped me word it in such a way that it's not too technical. Anybody can understand it. And once we're done with this, it'll be a series of blogs. And then we'll promote it through social media. And you come to my blog on my website, and then you can read. And over time, over a few months, you get all the information. And then over time, we're going to expand on that. So yeah, I'm not going to have like a book. It'll be electronic. It'll include videos. It will include, of course, the blog articles, an ebook later, and then online courses. So most of the information will be free. I will charge for some of the online courses, not all of them, but the ebook will be free. And of course the blogs will be free. So, and all the information is on my YouTube channel already. I'm not hiding anything. It's just a matter of how concise can you get the information, and how organized will it be. It'll be very organized, and it'll be very applicable. So give me a comment. How's the streaming now? Hopefully it works out well. Can you type in how the streaming is? Okay, so let's move on into the material. If this doesn't work, I'm at my house. I'm gonna drive to my office and restart. So see if you can add a comment. Three-second buff initially, but not currently. It looks good now. Okay, great. Thank you. I appreciate it. All right. Okay, so thank you. So let's get through this material. So the first thing I want to say is, okay, now there's a guy named Dr. Kraft, and he's studying diabetes, and he's passed away a couple of years ago. But this is back in the 70s, and he discovered that by the age of 19, 90% of Americans have high insulin, and therefore technically diabetes. Now, blood glucose being high is a late manifestation of diabetes. So you can have a high insulin at the age of 19, but you don't have chronically high glucose until you're 55. So decades can go by before you're actually diagnosed in conventional medicine, whereas you should have been diagnosed with high insulin when you're 19. Okay, so that is one of the first lab signs of chronic disease is high insulin early on in life. 90% of people by the age of 19. So what happens when you're in your 30s and 40s? Now your cholesterol is off. Your VLDL is too high. Your LDL is too high in relationship. The lipids are off. Then after that, now you may be gaining weight. Maybe you're not gaining weight. But after that, now your blood pressure is high. So this is what's called metabolic syndrome. And now you have, the standard like fatigue and overweight. Your waist size is too big, and high blood pressure, high glucose, metabolic syndrome. Okay, and now you might start to do something about it, and your doctor wants to give you statins or a high blood pressure medication. And whether or not you do that, what happens next is that your liver starts to get fatty. So fatty liver disease, and maybe your kidneys are starting to not work very well, and your filtration rate is low, and your creatinine is high. What I'm doing is I'm listing off all these lab markers that can go up or down abnormally because of the bad diet or because of being exposed to toxins or some pathogen, maybe, like I was talking about black mold, but primarily it's the diet. And it starts, early on, even in the teens, and you're not diagnosed with a straight out disease until you're 65 or 70, and that would be heart disease, you have a heart attack or cancer. But you can see the pattern, it's all, and the one underlying thing below all this is lactic acidosis, which I'll get a little bit into the definition of that now. I mean, if you've seen my other videos, I talk about it all the time. So the point here is when you first have high blood pressure, you go see a cardiologist or general practitioner, they give you a medication, but they're treating the symptom, right? Of course, you already know that. But keep in mind that lactic acidosis is the mechanism behind all of it. So where does your body take you? Later, does it take you into cancer? Later, does it take you into a heart attack or a stroke? Or later, or is it MS? Some people are so sick, they end up in a wheelchair at the age of 50. And I've seen these people recover by eating good food again. They're eating protein, they cut back on the carbs. They had a neurological problem. So it could be heart, it could be brain, nervous system, it could be a cancer tumor or something like that. So just keep that in mind, right? It's all the diet. And as you improve your diet and you get away from the high carbs, the refined foods, and remember what junk food is. It's high sugar content, refined wheat, usually added salt, and then some sort of a seed oil. Those are the 4 components of junk food. And that's what is primarily causing this cascade of events that I'm talking about that everybody goes through unless they work at having a healthy diet. All right, so lactic acidosis is then the thing that's underneath all of this. And so I'm going to switch cameras here. How fancy is this? Now I'm at this laptop camera. And here's an article then from February 22nd of 2019. And I'll highlight some of this. We're going to go through like the first few paragraphs, and you'll see how this relates. So it says lactic acid is produced physiologically normal processes and is a common finding in disease states. So lactic acid is normal and it's found in disease states. And when increased production of lactic acid or lactate is comorbid with decreased clearance, so you have too much lactic acid in the blood and then you're not able to clear it out because the liver and the kidneys are dysfunctional, then the severity of the clinical course escalates. Now this is exactly what they said back in the 1940s and 50s. This has not changed. The only thing that's changed is, who does this apply to? It applies to all the people back in the 40s and 50s. It applied to all the people that were chronically ill. Now it only applies to athletes and people who have 5 days left to live. Okay, so we need to go back to the way we used to think of it. Now, and then consider this. So if you have this idea in your mind of everything I just said, like high insulin at the age of 1920, and then these series of lab tests that show up positive over the decades, there are doctors who focus on the high insulin and they say bring the insulin down, which is a good point. And then other doctors say focus on the blood glucose when you're 50 years old and bring that down, and that's a good point. Other doctors will say, improve your cholesterol, at the age of 60. Okay, another good point. But all of those are just date coincident with how severe the lactic acidosis is. So if you go along the whole way and you say, let's keep lactate down, let's not burn lactate as fuel, and let's try to stay away from using sugar as fuel, but instead use our mitochondria and use fat and ketones. Getting into ketosis, having lots of mitochondria, lots of healthy mitochondria with fasting and burst training exercise, and then more meat-based diet, less carbs. That's how you enhance your mitochondrial function, and then measuring to get into ketosis. So the less you're in ketosis and the more you burn sugar, the more likely you're going to burn lactate, and then you get the lactic acid cycle chronically, and now you're a chronically ill person. And the lactic acid cycle is minus 4 ATP. So once you're burning, using lactate as your fuel, you start to waste away and you don't recover. This, you lose your muscle, you lose your body, you get weaker, and that's cachexia. But you can not recover when you're 35 years old or 40 years old. So let's pretend, exercising at the age of 20, you recovered nicely, but now exercising at the age of 40, you can't recover like you used to. And you know it, and it's stressful. And it's in your face when you talk to me. I can see it, how distressed you are about how you can't recover. And now another scenario would be when you were 20, you drink so much alcohol one night, and you wake up in the morning feeling fine, but now you're 40, and you drink the same amount of alcohol, and you don't feel this, you can't recover from that. It's the same thing. It's your ability to recover from poisons, and sometimes those poisons come from exercising a lot, breaking down muscle tissue, and it releases these amino acids and other wastes in your blood. So how well can your body clear these poisons, these wastes, and lactate? That's what I'm highlighting right there. So the less able you are to clear these wastes, the severity of the clinical course escalates. Importantly, the effects of severely elevated levels of lactic acid can have profound hemodynamic consequences and can lead to death. So what are these hemodynamic consequences? Right, I'm trying to highlight that. What that means is your heart is beating in a different way. Instead of beating like this, like it has been for decades, now it's a little bit twisted, and it's beating, and it's the flow of the blood through the heart and through the initial arteries has some eddies and turbulences. And then you get plaquing. You get blood clotting, plaquing. And I mentioned recently, I learned this from a guy named Malcolm Kendrick, who was interviewed by Ivor Cummins, that the main factor for for plaquing in the heart and arteries, when it comes to blood quality, is not LDL, it's lipoprotein A. He said that the plaquing, when we look at it previously, we would say, oh, look, there's a bunch of LDL cholesterol in the plaque. But Malcolm Kendrick said, no, it's not LDL cholesterol. It's LDL cholesterol plus a protein plus another LDL cholesterol. That's lipoprotein A. And I've known for probably 5 years now that lipoprotein A is a blood clotting factor. It's not like a cholesterol fatty plaque. Okay, it's a blood clot. So hemodynamically, when you have blood flowing and it's turbulent, then you get blood clotting increases. Okay, so lactic acid can cause hemodynamic consequences that can lead to death, meaning a stroke or a heart attack. That's what this is saying. So serum lactate levels can be both a marker to measure for risk, and as well as a therapeutic target, meaning trying to lower the lactic acid or the lactate. And I use those terms interchangeably, even though they're not exactly the same. So I have a patient, this is 2 weeks ago. I tested his blood, his lactate was 3.5, normal is around 1. I had him take 10 cataplex B. 4 hours later, it's 3.0. We dropped his serum lactate by 0.5 in 4 hours, and that's a great thing. And his kidneys were a little dysfunctional, so he wasn't able to clear lactate like you would like, and he wasn't exercising. That was just his new normal. would be a high lactate level of 3.5. But yeah, 10 cataplex B brought it down to 3.0 in 4 hours. So, and again, cataplex B was designed in 1934 for the purpose of lactic acidosis, and the recipe is the same as what it was in 1934. And what I just said is probably completely illegal. Okay, the higher the level and the longer the time to normalize your elevated serum lactate, the greater the risk of death. So if you have, you exercise, and let's say I work out at the gym, the next morning my lactate might be 3.5, and then the next day after that it's going to be 1. So my body clears out that lactate from the exercise. Now, but if I was ill, let's say I had various symptoms like diagnosis of fibromyalgia or diabetes, or as a heart patient, I would already have a high level of lactate to begin with. Then I go to the gym and I work out, same intensity, and I would be sore for 3 days or 5 days, and the lactate would stay high for the whole duration. So that's what this is saying. The higher the level and the longer the time to normalization of the elevated serum lactate, the greater the risk of death. So if there are 2 people going into, as an example, if there's 2 people going to the hospital into the ER and they have an infection, they both have a lung infection, and the one person has a lactate level of 1, and the other person has a lactate level of 20. Okay, and they're both given the same drugs for the same infection. The person that has the lactate level of 20 will die sooner, will need more attention, will be in the hospital longer, and will have a greater chance of side effects from the drugs, and more misery and more pain, and all these comorbidities all at the same time. So, and what's the difference between the two? Well, because the person that has the high lactate of 20 had a bad lifestyle, during the same course of time as the other patient. So the other patient that took good care of themselves has a normal lactate level of 1. So that's where the lifestyle comes into play. Eating the right food and exercising and do all those healthy things to make sure your liver and your kidneys are working well, and that the lactic acid can be cleared out, and that your muscles are healthy, etc., etc. Okay. So here we go. Lactic acid is normally produced in excess by about 20 millimoles per kilogram per day. So your body every day makes excess amounts of lactic acid, normally. All right, it goes into the bloodstream. It is then metabolized mostly via the liver and the kidneys, which I just mentioned. And it's like 85% liver, 15% kidneys. Now, the kidneys are delicate, and they're hard to recover if you have like poor kidney function as seen in a lab test. The liver, it's easier to fix. Like high liver enzymes, it's easier. Okay, so some tissues can use lactate as a substrate and oxidize it to carbon dioxide and water. What that means is those tissues will take the lactate and turn it into water and carbon dioxide, and you breathe it out and you pee it out, or you sweat it out, right? So not a big deal. But only the liver and the kidney have the necessary enzymes to utilize lactate for the process of gluconeogenesis. So the liver and the kidneys can turn lactate into sugar, gluconeogenesis. That means glucose, like sugar. Neo means new. Genesis is the formation of, like, the first book in the Bible is Genesis. So gluconeogenesis. So the liver and the kidneys can turn lactate into sugar. So this is super interesting. This is a great article. I'm glad I found it, and I thank you for listening to me as I go through this. The tissues which normally produce excess lactic acid include the skin, red blood cells, brain tissue, muscle, and the GI tract. So the muscles normally produce excess lactic acid. Well, that's your largest organ in your whole body. You have pounds and pounds of muscle, and the next biggest organ is your skin. And your GI tract is what, 22 feet worth of muscle and skin, basically, is what that is. So during heavy exercise, it is the skeletal muscles which produce the most excess circulating lactate, which normalizes in the absence of impaired hepatic metabolism, which means that as long as your liver is working well, you just clear it out, no big deal. But the moment that your liver is compromised, maybe from non-alcoholic fatty liver disease because you're eating too many carbs, too much bread, pasta, etc., and now you can't clear lactate. Now you're just starting your own chronic disease process from your diet. Okay. So in general, and I've said this before, elevated lactate can be a result of increased production or decreased clearance or both. Okay. So this next paragraph, I'm not going to get into it like in detail because it's pretty biochemical. But what it's saying is that the sugar known as pyruvate can be used to make ATP through the mitochondria in the presence of oxygen. However, under anaerobic conditions, meaning no oxygen, pyruvate goes into the lactic acid cycle. And like I said, lactic acid cycle is -4 ATP. So you want to make sure that your mitochondria are working well so you don't end up shunting your sugar into the lactic acid cycle. So let's see here. Now this is a good paragraph here. So pathologic and persistent lactic acidosis occurs when a combination of two variables coexist. That is, there is excessive production exceeding the liver's capacity to clean it, and for example with severe convulsions, okay, with impaired liver function. So if somebody has a convulsion, all their muscles get really tight. It's like, you know, you going to the gym and you're lifting weights and you're breaking down your muscle tissue and creating lactate. So somebody who has a 30-second or a 1-minute epileptic seizure, all their muscles get really tight. Now they have an excess amount of lactic acid, and if their liver can't clear it out, now they're in trouble. But other instances can occur, such as cirrhosis, so any kind of liver scarring, hypothermia, you're too cold because you're shivering. Once again, it's your muscles shivering. Sepsis is bacterial infection in your blood, and that's toxicity. And sometimes those organisms can make lactic acid, but you have too much waste in your blood, not enough oxygen. You have a starvation of oxygen in your blood. And then severe hypovolemia and severe hypotension, that's a loss of circulation going to your cells, and your cells start to die, right? So not enough hypovolemia means you're in shock and you have a loss of fluid in your body, maybe blood loss, or maybe you had some kind of shock and then you fainted, and that's hypovolemia to your brain and to your heart. Okay, and then severe hypotension. So those can all cause lactic acidosis, and this makes total sense whether you're in the hospital or not. You don't have to be 5 days away from death and have these symptoms. You know, these things occur on a minor scale on a regular basis with somebody who's chronically ill. Okay. What else do I want to say about this? Those are the main things I wanted to go over. Here, okay, there's one more thing. There's two types of lactic acidosis. There's type A and type B. So the first one has to do with lack of volume and circulation, so hypoperfusion and hypoxia. So the cells aren't getting nutrition, and that can be caused from the hypovolemic thing I was talking about. You can have like obstructives, like you can't get enough oxygen in your lungs, and it can be regional, like a limb doesn't get enough circulation, or it could be like some part of your intestines isn't getting enough circulation. You can have localized lactic acidosis. It's not just your whole body. It's not just, like your heart and brains and now you're passed out. You can just have lactic acidosis going on in your finger because you had like sickle cell anemia, or what's the one where people get really cold? It just slipped my mind. The other type of lactic acidosis does not have to do with lack of circulation, but it has to do with the inability of the mitochondria to process the sugars, the pyruvate. And so, make sure your mitochondria are working well. And so sometimes people are born with mitochondrial dysfunction, and they're more susceptible to becoming toxic, for example, from vaccines. They don't have the energy to detoxify themselves because their mitochondria don't work. And these people have a various list of symptoms that occur to them, from mitochondrial dysfunction, they get a genetic test, and sure enough, they test positive for this genetic condition. So the mitochondria don't work well. You get alternative metabolic pathways for pyruvate, such as the lactic acid cycle and also glycolysis. And so these are several other forms of energy production. Let me list them off real quick just to summarize that. Mitochondrial function, which is like ketosis and fat burning. So ketones, fat, sugar is glycolysis, lactate fermentation, that's lactic acid cycle, and alcohol fermentation, which is what alcoholics do. So you don't want to ferment alcohol unless you eat a whole bunch of rotten fruit. You want to do lactate unless you're sprinting and your muscles need some energy real quick. You don't want to do glycolysis unless you have to, maybe because it helps balance the hormones or other things like that to help people figure out when to come out of ketosis. The point is there are 5 energy sources, and you want to pick the right ones. Okay, but examples of this type B lactic acidosis due to liver dysfunction are liver disease due to mitochondrial dysfunction are liver disease, cancer, medications. Metformin is well known to cause lactic acidosis, epinephrine, and then total parenteral nutrition. That's when people have a feeding tube. And then HIV, low immune system function, B1 deficiency, that's thiamine deficiency, mitochondrial myopathy, which is like myopathy meaning muscle pathology, and so mitochondrial pathology in the muscles. And then congenital lactic acidosis, you're born with it. Trauma can cause this mitochondrial dysfunction, excessive exercise, and then diabetic ketoacidosis, which only occurs in type 1 diabetics, and then ethanol intoxication, so too much alcohol. So there you go. There's a whole bunch of stuff here that's easily applicable to everyday living. Like if you drink too much alcohol tonight, you could be in trouble. You could have lactic acidosis, and then you could. And I used to know a chiropractor. He would drink his beer and take his B vitamins, and he would do this all night, and it prevented hangovers. It prevented, excessive fatigue, and I just explained how that works. So it's the B vitamins that fix the lactic acidosis situation. Raynaud's syndrome, yeah, that's when you can have like a finger or a series of fingers or your hands get really cold, and you can have like a localized ischemia there, causing lactic acidosis. So let's see here. So there's a lot more with this. I'll put the link below, but they talk about the history for the patient and like a physical examination and evaluation, but primarily it comes down to symptoms. And you can run some lab tests, and I do that. But like I mentioned earlier in this video, the moment people realize that they don't recover like they used to, that's primarily going to be this lactic acid mechanism, where their cells aren't as able to take in nutrition and remove waste, and the cells starve and they die. And people are deficient in B vitamins, so now they're more fatigued, and they also crave sugar, another sign of B vitamin deficiency. And another, like a sign of like a condition with alcoholism. Alcoholism is another sign of B vitamin deficiency. So when you have people getting off of alcohol, they're told by AA, Alcoholics Anonymous, to put a lot of sugar in their coffee. So they're just trading one drug for another, when you look at it metabolically with the cells. So instead of trading alcohol for sugar, what you need to do is trade alcohol for beef and fat. Load up on as much beef as you can and get your mitochondria working again and get into ketosis. And then maybe get into some fasting and increase the number of mitochondria you have. It's a mitochondrial problem, is when you're always craving beer and alcohol. So there's that. All right. So this is kind of a technical thing, and how long has it been? It's been 30 minutes. I'm trying to keep these down to 30 minutes. And hopefully the live stream didn't go haywire because the connection was poor. Ask me a question. I want to see if I type something in the comments. Make sure Everybody's still with me. Is anybody there? Yeah, so other things besides bad lifestyle, birth control, antibiotics, medications, certainly steroids. Yeah, so a lot of that stuff. Fermenting fungus. Right. Okay, cool. I don't know if this live stream is going well or not. I'm gonna have to plug in next time and do a hardwire. So, but I appreciate everybody watching. It's been 30 minutes. Let's end off here. I will be on live again, and I'm actually gonna be on a plane in two days, so I won't do a live stream. But I'll be in touch on YouTube, and if you have the need for some help, here's how you can contact the office. You can call or email right here. The email address is intake@neca.com, and there's our phone number right there. And thanks, Dr. Derek Strong. I just saw you the other weekend. We met for the first time. Can you stay in ketosis forever? Yes, the answer is yes. And you may want to come out of it sometimes. You might feel better by coming out of it and then going back in. My mother always says, if you drink, eat meat. If you drink, alcohol, then eat meat. That's true. Ask your staff for links to articles on AMA and the Rockefellers. The streaming is going very well. Okay, great. Thanks. I appreciate that. Wish I had found you sooner. Yeah, so we're taking new patients, and you can contact my staff by phone or email right here, and you can become a new patient. We talk to people. We do long distance consulting. Sometimes people fly in for a number of visits, maybe 5 in 3 days or 3 in 2 days, and we do a face-to-face. I do the muscle testing, take a thorough history, put you on supplements. By the time you leave, I need to be happy. I need to be happy with your program, and then I'm expecting improvement over time. We catch up on the phone, like in 3 weeks or 4 weeks after that. And over the course of time, we're looking for improvement. Now, I was interviewed this morning by Dr. Sean Baker. I'll be on his podcast in 2 weeks. That was really exciting. We talked for an hour and 50 minutes. An hour and 50 minutes. So it was a long talk. We went over a lot of material. And so look out for that. That'll be out in the next couple weeks. Okay, so cool. I'm going to let you go. I don't know if I'm able... How do I close this off? I'm still new with this live streaming thing. I appreciate your patience with me. I appreciate you bearing with me. We'll all bear together. All right. Take care. Bye.